In this video today, we're going to talk about what is the best utilization of a topical pain patch and how to be able to make it as optimal as it possibly can be. If we haven't met, I'm Dr. Orlando Landrum. I'm a physician who helps patients understand their options for being able to relieve pain, whether it's physical or mental, and how to be able to take this information and insight, talk about it with your medical provider, and figure out how to be able to punch pain in the face, get back to leading the life that you deserve, and really be able to enjoy the things that you want to do. Today, we're talking about topical pain patches. We've had another video that covered it in some degree in detail a number of years or so ago. Currently, what we want to do is to kind of give you the best sciences and kind of dispel some of the misconceptions that were out there. And some of the things that were present is initially when we talked about utilizing patches, it was equated to the same as what using an oral medication would be. So let's talk a little bit about that. One particular paper that talks about this and explains it a little bit better is the following: transdermal and topical drug administration and treatment of pain. In essence, this picture really kind of is worth 1,000 words. And so this picture is of specific types of patches that we're using for topical administration of medications to be able to try and treat pain. So the different meds are things like lidocaine from left to right, capsaicin, skipping over this morphine component at the moment, NSAIDs, tricyclic antidepressants, nitrates, and cannabinoids, right? So these are trying to be able to target the receptors or nerve receptors that have a specific place for binding to the release of the different substances. And they work right there at the site where those nerve fibers are, versus medications that actually get within the bloodstream and attempt to spread in something that's called a systemic way. So a systemic way is a way that basically, instead of taking the medication orally, it's deployed from across the skin and is meant to go throughout the entire body. The reason why a topical patch has utility is because it can decrease the degree of side effects and it can be present right there at the site. So that way you don't have to deal with side effects that can be present. So if you know that you normally take a pill or other things and you have nauseousness associated with it, dizziness, or you just really can't tolerate traditional oral medications, then a topical application may be the route that you want to go. The next paper looks at really a summation of what works best. So the Cochrane reviews typically take a look at a number of different studies and evaluate them in depth and detail. And for this, it looks at acute and chronic pain. We're going to talk about kind of the overall summation and then look at different summations of what worked best in certain conditions. So the initial aspect was this looked at topical painkillers in relationship to placebos, and they saw that a good number of NSAIDs seemed to last, give or take, about over about a week in and around in 1 out of 2 to 1 in 5 patients, and that the vast majority of them seem to work well in certain situations. These are going to be things like diclofenac, flexure patches, and things of that nature. For those patients that had arthritis, traditional topical application of diclofenac or ketoprofen was pretty darn useful. And then for low concentration capsaicin was useful in about 4 out of 10 patients. And they found the side effects were very rare in about 1 out of 12 patients. They had some degree of side effects, but they were pretty much almost all local. And those side effects were not serious. They were things like redness or erythema and things of that nature. So let's talk about the different classes. So a couple of those classes are going to be things like the NSAIDs, which are anti-inflammatory medications that can be able to be helpful for musculoskeletal pain or for rheumatoid arthritis. Things like local anesthetics, which include things such as 5% lidocaine and can be useful from everything to postherpetic neuralgia to dealing with peripheral neuropathy or centrally mediated pain from a number of different reasons. Or we can be able to look at things like capsaicin or tricyclic antidepressants and nitrates and how they can be useful specifically for things like neuropathic face pain, burning mouth syndrome, osteoarthritis, fibromyalgia, or tricyclics in the context of peripheral neuropathic pain, carpal tunnel, coccydynia. And then nitrates useful for rheumatoid arthritis and ankylosing spondylitis. I know that I'm using a lot of big fancy words, but at the end of the day, we can tell that there are different utilizations that we're going to kind of sum this up in a second. But at the end of the day, you know that there's a number of patches that are out there, right? And indeed, I am just getting warmed up. We got a couple more classes to deal with, and the most prominent of that would be the alpha-2 agonists like clonidine, which work in a whole host of different ways through the G receptor protein system. But at the end of the day, they can be useful for diabetic neuropathy, for migraines, for face pain, and for complex regional pain syndrome. So kind of give you an insight about what exactly is the best use of which patch when so we can get the best result. Well, this gives a summation. Don't get too concerned about it. NNT, just so you know, is number needed to treat in order to get a response. So musculoskeletal pain for strains and sprains, diclofenac and ketoprofen seem to work pretty darn well. If we're looking at chronic musculoskeletal pains, what we're looking at is topical diclofenac placed there. And if we're looking at postoperative neuralgia, we want to use a high concentration patch in order to be able to get some degree of improvement in efficacy, things like a Qutenza type patch. At the end of the day, we know topical patches can be able to give us benefit, not have many side effects, and be able to be utilized when utilized for specific conditions can give us a response that can be just as robust as traditional medications and treatments without the side effects that are associated with it. If you found this video helpful, please hit the like button. If you want to learn more about treatments like this, hit the subscribe button. If you have questions, comment below and let me know what are some of the things that you have concerns about or issues, or what are some of the things that you like and you said, yeah, this worked for me. Please let me know. Thank you so much for your time. Hopefully we can be able to help you learn your different options so you can figure out how to be able to punch pain in the face and get back to leading the life you deserve. Thank you.